welcoming Senator Richard Moore and Representative Denise Provo.
Thank you, Amy. And one of the benefits in serving in a state that does not have term limits is that you can be around long enough to see progress actually made on some initiatives that you've cared about for a long time. When I became the health chair in 1999, one of my first initiatives and priorities was really to focus on medical errors, and in particular infection problems that were constant and problems across the country. And we weren't doing a great job in that regard as a state compared to some of our sister states. But we clearly, even before 305 and 58, that we created and funded the infection prevention program, which I think has been a key. And so it took time to get that established, because you want to do it right, and you want to do it in a way that the providers aren't going to say, oh, the numbers are wrong, or they don't know what they're talking about. But agreeing on what the process is, and I think the steps, while it's taken longer than I would have liked, the steps that have been taken to bring everybody on board and get out to all of the providers, and then over time to keep expanding that survey so that we cover all the different types of infections that are particularly problematic for us, I think is going to be really critical. The reports are interesting in what we're seeing, and now that and publicly reporting this will, I think, really put the pressure on boards of trustees of hospitals and the leadership of hospitals, as well as the physician and nursing community, to focus on this issue and try to fix it, try to do a much better job, because we can do better. The numbers, while as we compare ourselves to the rest of the nation, don't look all that bad. We're at or below what the nation is. Problem is the nation's not so good. And so we really need to do better. I want to see all those columns of numbers after the hospitals just saying that we're doing substantially better than the national average, not at or below or just below the national average. And also for all the types of infections that plague us in our healthcare system. When we get to that point, then we will have arrived. This is the first crucial step in the issuance of this public report, hospital specific, that will give us the baseline. And I suspect next year, even with a lot of effort, the numbers will still be higher, because we'll start getting better reporting, and we'll be adding some additional types of infections. So that will, obviously, by its very nature, will increase the numbers. So we'll need to be able to explain next year how the report is and why the numbers are, that it's not like we're having necessarily, hopefully, any rampant epidemic of infection, but that in fact it's because we're getting better at the job and being more effective, and really helping them, working with the hospitals and other health providers, to really be able to focus on what can you do to get to eliminate this problem, or at least reduce it to where it can be reasonably dealt with. Part of it is, of course, sometimes people come into the hospital with infections, and we can, some hospitals have screened them coming in, and maybe that's something we need to do regularly. But we really need to get at this problem, and the first step is right now with the report that's been released, with indicating by each hospital what the problem is, and how. Then the next question would be to each hospital, what are you doing about it? And many of them are working aggressively. Some could work a little harder. And not only the hospitals, I like to tell the doctors when I talk to them that we've known since Oliver Wendell Holmes Sr., not the judge, the doctor, was the president of the Massachusetts Medical Society. That wasn't last year. That was about 150 years ago. We knew that infections were killing people, and we ought to have made progress. And the CDC still tells us that over 40% of physicians don't routinely wash their hands in between patients. And that's just not acceptable. And I think these numbers will help us to focus and to show there's still a need to work harder. And that's what my hope is, that we will continue to put that pressure on now that this information is coming out and will be available to the public, and more importantly to the medical profession, so that they know that they're being held accountable, and it's transparent. And transparency and accountability are very popular these days. We, however, intend to make it, I think, part of our regular routine of doing business into the future. So I congratulate the department for their work. We want to keep you working, and keep you working even harder and more effectively to keep this pressure on on both the providing the institutions as well as the individuals who are part of the healthcare system to make sure that we do have an infection-free, as much as that can be achieved, system here in Massachusetts and hopefully ultimately in the country. Representative Provost.
Thank you